Good afternoon. Okay. Good afternoon, everybody. It's a nice warm day. It feels like summer. Hopefully everybody has an opportunity to get outside today, see the sun, and maybe take a walk. I want to thank everyone for again tuning in today. I very much appreciate it, and I continue to hear from people that they find the rhythm of these events to be helpful and calming. So I would encourage you to continue to tune in and learn everything there is to learn around how you can keep yourselves and your family safe, how you can reopen your business, how you can be successful through phase 2 as we continue to live with the coronavirus in Rhode Island. I'll be here tomorrow at 1 o'clock, and as a reminder, starting next week, we are going to do the 1 o'clock press conference Monday, Wednesday, and Friday. So I'm going to scale back from 5 days to 3 days, and I look forward to seeing you all next week, Monday, Wednesday, and Friday at 1 o'clock. I will say that it is exciting. I find it exciting that we're into phase 2. You know, we're going out for dinner again, you know, beginning to send our kids to camp. Childcare centers opened. We're having an excellent experience so far this week with childcare centers. Folks are sending me pictures of their kids in these childcare centers. So it's, you know, people are going to the beach, the parks are open, people are getting haircuts. It's all good. It's really good. And it's what we want to do. We want to continue to get back to business and get out of the house, get our lives back on track. I will just continue to remind you, the virus isn't gone. It is not going to be gone. It's still here. It's still dangerous. It's still particularly dangerous and deadly for older folks and people with underlying health conditions. We've just learned how to deal with it. So what that means is, even though we are leaving our homes, doing all the great stuff we want to do, please follow the rules. Please, please follow the rules. Social gatherings are limited to 15. If you can work from home, work from home. Wear your masks, wash your hands, stay at home if you're sick. If you feel sick, call your doctor, get tested. Do not go to work or go anywhere if you feel sick at all. Keep socially distanced. And this is all of us. You know, this is all of us. If we do that, if we double down on the rules, we will continue to reopen the economy and continue to be safe. So I'm going to continue to say that, because I keep hearing, some people are saying to me, oh, the virus has died down. That's true. It's died down because of you. You've done great work. So continue the vigilance, and also enjoy the fact that we can start living our lives more normally again. We're at 43,000 downloads of the Crush COVID RI app. I'm going to ask you every day, download it if you haven't. It takes a minute. I tried to explain why it's so important yesterday. If you get sick, you're going to get a call from the Department of Health. They're going to want to know who you've had contact with, and they're going to call all of those people to let them know they were in contact with somebody who tested positive. So it'll help everyone and save lives if you can keep your contact tracing notebook and download and use the Crush COVID RI app. Okay, we'll begin as we always do with the data. If you could put that on the screen, please. As you can see, it's another good news day here in Rhode Island. As you can see, the numbers are continuing to trend in the right direction. We've had another 100 cases to report, and very sadly, another 14 deaths. I'll say, as I do every day, every one of those deaths is a loved one. So let's just remember that, and remember that this suffering is real. It's in our community, and just take a moment to recognize that. But overall, this is a good news story. Hospitalizations continue to trend down. We're into phase 2. If any of the steps we took in phase 1 were going to cause a problem in terms of spikes or increases or increased rate of infection, we'd be seeing that now, and we're not. So for those of you who are still worried, have confidence. We made a lot of changes in phase 1, and if that was going to result in the virus coming back, this is the week we would see it, and we're not. So I feel very good about that. Today, I'd like to devote the majority of the rest of my time with you talking about our healthcare system. Obviously, as we've lived through and been fighting together this public health crisis, healthcare is on everybody's mind. And I will say this. Now that we're at this place, we are going to have to begin to turn to the business of rebuilding Rhode Island, rebuilding our economy, rebuilding our communities, and rebuilding our healthcare system. And we're going to have to do that. The healthcare system is not going to look the same a year from now as it did when we started this, because we've learned a lot. We've had to embrace innovation. And so now when we are committed to it, we need to strengthen our healthcare system, we need to strengthen all areas of our economy, and we need to rebuild in a way that makes our community, our economy, and our healthcare system stronger and more resilient and more effective than it was when we started. There's no question that throughout the past few months, access to quality healthcare has been absolutely vital for every Rhode Islander. Having said that, in many ways, the virus has brought Rhode Islanders away from the healthcare system. And we've seen that. We've seen a real drop in primary care office visits. We've seen very concerning drops in immunizations among our kids. We've seen, obviously, we essentially closed our hospitals to any non-COVID or non-emergency services. So we've seen disturbing things, cancer patients putting off treatment, patients putting off testing or procedures or surgeries. And it's time that we really get serious about addressing that. The virus has also worsened health disparities and highlighted the pressing need to root out inequities in access to healthcare. By the way, this is an area of top priority for me, also for Dr. Nicole Alexander Scott. You'll see she's not here today. I'm joined by Dr. McDonald. She's deeply committed to this work. She's also fine and healthy, just working on another project right now. So we're lucky to have Dr. McDonald. This inequity that we've seen revealed or spotlighted through the crisis is real and something that we can't accept. So as we get to the business of rebuilding and strengthening our healthcare system, we have to do it in a way where we reduce disparities and inequities that have long existed in our healthcare system. And just like we've invested in housing and food and basic needs to help Rhode Islanders stay healthy through this pandemic, we also need to invest in our healthcare system to make sure it remains viable, financially secure, responsive to Rhode Islanders' healthcare needs during the crisis and after the crisis, again, particularly for the most vulnerable among us, and in a way that is fair and equal and equitable across the board. As I said earlier, if we're going to do this, if we're going to shore up the healthcare system, strengthen it, provide equal access to all Rhode Islanders, we're going to need to get creative. We need to figure out ways that we can get more serious about investing in primary care, about investing in ways that reduce health disparities, about investing in our communities, about investing in prevention, about investing in telemedicine and telehealth so that everyone can have access. We've seen great progress with telehealth through the virus, and we need to do it in a way in which we are careful to keep an eye on our costs. We have to reduce duplication, excess, inefficiency, so that the money we're spending goes to the point of care. And we have to get serious about providing more care, but also while maintaining our costs. Now, luckily for us here in Rhode Island, long-term commitment to this work has begun long before the COVID crisis through a group of healthcare, government leaders, community leaders, business leaders that have been convening for years around this topic. And I should say, I do feel proud to be a Rhode Islander. We have nearly everyone in Rhode Island has health insurance. Nearly every child has health insurance. In some ways, we have excellent results, and I'm proud of that. Clearly, though, there is a lot more work to do. About a year ago, the Rhode Island Foundation put together a group of people with my support to really double down and think about Rhode Island's healthcare vision. And later today, I'll be signing an executive order affirming my administration's commitment to that work of health system transformation over the long run, and making sure that we have a statewide long-term healthcare plan focused on improving health for all Rhode Islanders. That means committing to take action to address the economic impacts of COVID on Rhode Island's healthcare system. And we're also convening an advisory group to help us work on that, to work with my administration and my team to enact some of this change. I do want to thank the Rhode Island Foundation for their leadership and also for their commitment of $1 million to support this work on a go-forward basis. That funding will be used to make ongoing investments, most likely in the form of grants, to root out health disparities and better support preventative health. I also want to share with you a few things that we're doing right now. So the work I just talked about and the executive order I'm signing is meant to help us have a long-term plan, and we're going to keep working on that to achieve a vision similar to what I laid out. I do want to let you know, though, some of the things we are doing right now, because the reality is our healthcare system is stretched and fragile in ways that I don't know if it's ever been before, and not for a very long time. The reality of this crisis, the COVID crisis, has taken an unbelievable toll on our healthcare system at a time when people need healthcare more than ever. And that's in every aspect. Financially, the toll on frontline workers, patients, the community. And so it's very important that we're there to shore up our healthcare system, as I said, so that we come out stronger on the other end. So last week, my administration launched a hospital relief fund. We're committed to investing up to $150 million of the state's emergency COVID relief stimulus money from the federal government to help hospitals offset immediate costs and to prepare for the future. We've made this funding available to ensure that our hospitals stay open, stay financially viable, stay safe, and are focused on making the changes necessary to remain viable during the crisis, but after the crisis. So the reality is, we asked hospitals to cut down on the services they were delivering. That means they saw massive drops in their revenue. Now, they did the right thing. At the same time, their costs were increasing. Costs for PPE, costs to meet the COVID crisis, costs for testing. So we need to be there for them. And they need to be there for their frontline workers. And by the way, I'm going to keep saying that because as we begin the rebuilding of Rhode Island, I want us to keep the frontline workers forefront in our mind, making sure that they have the support and the wages and the retraining that they need in order to be safe and successful and have fulfilling careers. So this money, it's up to $150 million. There will be more to come. This is like the first immediate emergency tranche, a bucket of money to get out to our hospitals to make sure that they can stay financially secure and safe. And I want Rhode Island to hear that. I want you to know we're doing what it takes to shore up our hospitals. Today, I'm also excited to announce that we're going to be convening a new Pediatric Advisory Council led by Dr. Nicole Alexander Scott. We will be also using our COVID emergency relief funds to distribute millions of dollars in relief and support to pediatric practices. All primary care and physician groups have been hit hard. That is doubly true for pediatric practices. They are most heavily dependent on Medicaid, which have lower rates. They haven't had great success with telemedicine. It's obviously harder to do telemedicine with little kids than adults. Parents have been afraid to take their kids in for immunizations, to take their kids in for routine care. And so as a result, our pediatricians are hurting and we need to be there for them. They deserve it, but frankly, it's good for Rhode Island. We need a strong system of care in the community. I think later today, the Department of Health is going to post the names of the pediatricians on their website. And I have tasked this group, I've asked this group to really get a pulse on what's going on and what more do we need to do to keep our kids healthy. I will tell you, I am very concerned about the fact that through the crisis, we've seen childhood immunizations drop by more than 35%. Some practices say as high as 50%. We need to get on that right now. And I know the pediatricians are ready. So we are going to invest money in pediatricians. We are going to support them. And we're going to come up with creative strategies to make sure that parents get their kids back into the pediatrician's office as quickly as possible to get these kids immunized. That's a disaster waiting to happen. 30, 40, 50% of our kids missing their immunizations. If we don't fix that now, next winter, that's going to result in potentially devastating healthcare issues. So if you're a parent and you're hearing me say this, and you're still afraid to take your kid to the doctor, I'm asking you please to call the doctor, schedule an appointment, and go ahead and get those immunizations. If you're a pediatrician and you're hearing this, I hope you're hearing me say relief is on the way in terms of support and money, and we're going to be there with you to help your practices stay open and stay financially viable, and we're going to help with the community supports. By the way, the same is true. We're seeing the same trends in kids not going to primary care physicians, mental health providers. So I really want to encourage everyone, adults and children, if you've been delaying your appointment to the doctor, delaying your appointments for mental health, delaying your cancer treatments or procedures that you had scheduled in the hospital, please consider, I'm just asking you please to call the doctor, call the hospital, reschedule, get an appointment, and keep yourself healthy. And know that at the same time, we are making big investments in our healthcare system so that you'll get the care that you deserve. We've also taken great strides, as I said a couple minutes ago, to expand access to healthcare via telehealth. We have found that, particularly in certain specialties, to be an excellent substitute for some in-person visits to the hospital. So through this crisis, I've signed an executive order and worked with our health insurance commissioner to direct health insurers to cover telemedicine for primary care, specialty care, mental and behavioral health care conducted over the phone or video conference. And we have required that reimbursement rates for that telehealth be equivalent to in-person visits. I have extended that executive order. I signed it again last week. I've extended that executive order for another 30 days until July 5th. So if you're a provider who's been caring for your patients through telemedicine, know that you could continue to do that and receive the same payment from insurance companies until July 5th. If you're a patient who's been taking advantage, we took that step because we knew everyone needed access to healthcare during the crisis, and yet it wasn't always safe to leave our homes. It has turned out that through that innovation, like a lot of innovations we're seeing, it's a great thing to do. It allows us to help equalize healthcare and get healthcare to everybody. You can imagine how this is helping people who don't have a car. You can imagine how this is helping people for whom it's just difficult to get to the doctor. So I want to continue to break down barriers to access for healthcare. Again, back to this theme of reducing disparities and improving equity. And one very powerful way to do that has been telehealth. So I've extended the executive order until July 5th, but I want to work to make this permanent through statute, because I think the people of Rhode Island and the providers of Rhode Island deserve a continuation in a stable way of telehealth, not just executive order month to month. In the coming days, I'll be back to share more about additional investments that we'll be making in our health equity zones. You've heard Dr. Alexander Scott talk about that at length. We'll also be using our COVID stimulus funds to make investments in primary care and other critical areas of our healthcare system. I would say that as hard as this crisis, the healthcare crisis is and has been, it also presents opportunity. And as we get to the work of rebuilding Rhode Island, rebuilding our economy, our communities, and our healthcare systems, let's do it in a way where we bring about the change that will make our systems better for everyone. A lot of these changes I'm talking about and have been talking about, reducing our reliance on institutional settings, increasing home care for our seniors, investing in our frontline workers, making healthcare rooted in the community and primary care stronger, enabling telehealth, bringing down costs through greater integration and having a less fragmented, better coordinated healthcare system. These are things we've been talking about for a long time. Let's use the occasion of this crisis to actually take action and drive unprecedented change in our healthcare system in a way that we can increase quality, decrease costs, and build on the strength of our size and have a more coordinated, integrated system. I also want to say thank you. For better or for worse, my administration has had a lot of time in the past 3 or 4 months talking with people in the healthcare system, sometimes on a twice daily basis, talking to hospitals, talking to pediatricians, talking to PCPs, just in the community. They have been talking to nursing homes, talking to home care providers. You have all been unbelievably collaborative, cooperative, creative, and worked with us to meet the crisis. So let's maintain that spirit of partnership and as we continue to rebuild our system. Last thing, continue related to healthcare. We've talked a lot up here about nursing homes, and I think that we've learned a lot about nursing homes. We've learned that they take care of so many of our loved ones, and we've learned that infection control is very difficult in these congregate care settings. I am also deeply committed to making sure that every one of our loved ones in a nursing home is safe. So to this point, the state has invested millions and millions in dollars of providing increased reimbursement rates for nursing homes, providing them with support from the National Guard for infection control, providing them with personal protective equipment for their frontline staff, really tens of millions of dollars to shore up our nursing homes to make sure that they are healthy and secure to take care of our loved ones. Specifically, I think it was a month or so ago, I announced an effort to provide increased wages to the lowest paid frontline nursing home workers, folks who make $20 an hour or less. And today I'm announcing that we're going to continue that initiative for another 2 weeks through June 15th. This isn't a forever thing, but it's important for me. These are people who some of these people have worked without a day off or very few days off in very, very difficult, scary situations. And frankly, our nursing homes are seeing staffing shortages. So in order to make sure that our homes have the staff they need to take care of folks and that the frontline workers are properly compensated, and by the way, this is all congregate care, DD group homes, the Buddha group homes, congregate care settings and nursing homes, I'm extending that increased pay program for another couple of weeks. I know there's a lot of effort in Congress to make sure that in the next federal stimulus relief bill, there's a more permanent measure to support low-wage workers in the healthcare industry. That is something I am very supportive of and working with our federal delegation to make happen. In the meantime, we're doing this to meet the immediate need. So that's what I have for you today. Today we have Dr. McDonald filling in for Dr. Nicole Alexander Scott. He'll say a few words and then I'll come back to answer questions.
Well, thank you, Governor Raimondo. I want to say good afternoon to everybody. Good afternoon to Rhode Island and all beyond who watch us, who are following the Rhode Island story. I am Dr. Jim McDonald from the Rhode Island Department of Health. So we do have 100 new cases to report. There's 185 folks in the hospital right now. Of those, 42 are in the intensive care unit and 29 are on a breathing machine or a ventilator. We did lose 14 more of us. And it's hard to see that. I think, one of the things I think about the virus is the virus is a thief. It steals our life. It steals our our health. It steals our joy. The virus has stolen a lot from us. And I just want to put it out there. It's like this virus is a problem and it's something we're dealing with. So regarding the executive order the governor mentioned, I want to thank all the healthcare providers and all the healthcare facilities throughout Rhode Island for their tremendous patience, their commitment, their dedication, their flexibility. This has been an unusual time for us. I think a lot's been demanded and it's been given without complaint, I might add. It's great to have colleagues who are like this. I'm a pediatrician when I'm not working at the Department of Health, and I just want to thank the clinicians who'll be involved with Dr. Nicole Alexander Scott and working on the Pediatric Advisory Committee. Routine care for kids is important. As a pediatrician, I look forward to checkups, and I know my patients do too, and I think most kids look forward to going to the doctor when they're well. It's fun, right? And what do we do there? We do immunizations. That's probably one of the most important things I do. We talk about nutrition, what to eat, what not to eat, what to do with those eyeballs so you're not staring at a computer all day long. We also talk a lot about being safe at home, injury prevention's a lot we talk about with people of all different development and ages, because it's really important for mom and dad to kind of know, hey, where are we with our little guy? What do we look for next? That notion of what to look for next, whether it's development or safety, is called anticipatory guidance. So we do a lot of that as well. And I just want to talk a little bit about a different topic, though, and it's something I learned when I was in 3rd grade. It was a topic called interdependence. In society, we hear about our healthcare workers as heroes, and by gum, they are heroes. They do a lot of good work. Healthcare workers think of others first, themselves second. It's really part of what heroes do. And really, you don't go into healthcare unless you're other-oriented. This is just other ways to make a living. But when you're healthcare, compassion, empathy, it's how we're wired, so it's what we want to do. But it's a time, I think, during the pandemic for us to reflect a little bit how interdependent we all are with each other and how essential we all are with each other's lives. I really came to appreciate this when I was dealing with a different epidemic. As some of you know, I used to work for the Indian Health Service. I worked on the Navajo Reservation in Chinle, Arizona. During the summer of 2005, we were dealing with an outbreak of Shigella. There's no reason why you should know what Shigella is, but it's a bacteria that causes bloody diarrhea. It's cramping, it's uncomfortable, it's painful. It can be life-threatening, can be cause of hospitalization. It's a terrible thing. But yet, unlike this, it's treatable. So if people go to the doctor, we can give them some medicine. A little bit of background about Chinle. It's really 90 miles from the nearest city. It's a great example of abject poverty, though. It's hard to emphasize how poor this area was. I remember my wife and I were going out there for the first time. We flew into Albuquerque. We're driving up there, and my wife and I were just looking at like, how far can you go without seeing anything? And it was just really eye-opening to me. But we found this place, and we were there for several years, and we really enjoyed the work we did. One of the things that was common, though, is patients would ask us to write letters for them. It was not unusual for a patient to ask for a letter to have a paved road to their home, or a letter for them to have electricity to their home, or a letter for them just to have a home. And those are all essential functions of life. So me and the other doctors in the pediatric department wrote letters. And my job there was to run outpatient medicine, but also just to be a pediatrician. So I enjoyed seeing patients. But as we're dealing with this Shigella outbreak, I had one mom come in to me one day. It was one of my patients who said, I need soap in my kid's school bathroom up in Salie. Salie was a town about 20 miles north of us. And so I said, come again, you need soap in the bathroom? And she said, no, there hasn't been soap in the bathroom for several weeks, and I'm not sure why. And I said, well, that can't be true. So I write a letter, because you write letters, right? But what I did after that was I emailed the public health nurse, because Chinley's a public health service hospital. So health department's a big part of the hospital. So I emailed the public health service nurse. She gets in her Jeep, drives up to the school. Lo and behold, there's no soap in the school bathroom. So that was a problem. We're having an outbreak, and there was. But it really reminded me of how soap was so important. And we did all of a sudden manage our outbreak. And Shigella is a terrible thing, mind you. Can you imagine living in the desert? It's the summer, it's hot. You don't necessarily even have indoor plumbing, how miserable it was. It was great to get that epidemic contained, all because someone who was a janitor was able to go in and solve it with soap into the bathroom. And I just, to me, it was struck by how important that janitor was. Here was someone who saved lives. And I say that in all sincerity too, because I'm a physician. You hold me in a certain esteem in my culture, but soap humbles me every day. Quite frankly, soap has saved more lives than all of us will combined as physician. I just want to remind you though, as I think about how interdependent we are, I really needed that janitor to do that in that school, and that was really important to those kids. But I'm relying on so many other people just to get by in my life, and I hope you appreciate this as well. I don't grow food. I need the people who grow food. When I go to the grocery store, I'm thrilled that there's food for me to choose from. And by the way, I don't know how to make electricity. I don't know how to deliver it to my home. I'm so glad there's people who know how to do that. I don't even know how to fix my car, my friends. And there's a lot I just don't know how to do, and I really rely on other people. My air conditioner broke last week. So thankful Sam came and fixed it. That was super. And I think about sanitation workers. I need Charlie's Rubbish to take away my garbage every Tuesday. That's really important to me. I'm thankful for teachers. And I don't want to name every profession out there. It kind of defeats the point. What I'm saying is we're all interdependent on each other. And as I look at this pandemic, one of the things that crosses my mind is we can look at this virus several ways. It is a thief. It has stolen so much joy from us, some of our lives. It's stolen some of our health. But one of the things we can do about this pandemic is we can take a moment to look at what is going on around us. One of the things I've seen is I am just more aware. I am interdependent. I am desperately interdependent on everybody in my culture. I need all of you. And I just hope that's out there, something we can all just think about today. Let me stop there and turn it over to the governor, and thank you.
Governor, if I might, all your discussion about reconfiguring the healthcare system raises the question of where are we in terms of the hospital merger, Lifespan and Care New England. Are you in these talks? Where are these talks? Is that a part of this reconfiguration that you've discussed?
Great, excellent question. So I am supporting their efforts. I am not, when you say am I in them, you may recall last summer, I led an effort to convene the leaders of those two systems in order to try to drive us towards an integrated academic medical center. Unfortunately, that didn't work out at the time. This effort is being led by them. So the hospital administrators called me a couple of days ago to advise me that they were doing this, but I have to give them a lot of credit. This is being driven by them. They're working together. And I have said to them, let me know how I can support the effort, but it's really being driven by the leaders. Look, there's a lot of unknowns, so we have to figure out how will it be done, et cetera. But the concept is very consistent with what I'm laying out here. Better integration, better communication, less fragmentation, investments in community care, and I will add a commitment to the workforce. I think that's very important.
How do you envision all of that coming together?
I'm sorry?
How do you envision all of that coming together, all of that?
I think there are different ways that, they've just started. They're giving themselves, I think, 90 days to figure out the details.
Reworking the healthcare system in the state.
I'm sorry. Okay. Yeah.
What is it you're looking for? What's the aim?
Yeah, so some of it's what I announced today, investments in primary care, investments in health equity zones, investments in pediatricians, investments in frontline employees. The vision that I have that we need to move towards is tilting the system away from the most expensive institutional settings towards, home care and primary care, towards preventative efforts, and really towards health, a focus on health and equity, which means a lot of this has to happen in a community. So what we've seen is we've learned a lot in this crisis. We've learned that there are inherent struggles with infection control in nursing homes. We've learned that we need to do more to shore up our home health care system. We've learned that hospitals are fragile. Our hospital systems are fragile, and we're going to be there for them. And thank God we got the money from Congress to, as I said, this $150 million. But if they come together and have an integrated system, they'll be stronger, both financially and also in delivering care.
The salary boost you talked about for hospital or healthcare workers who are paid under $20, how much does that cost to date? How much do you anticipate it's going to cost in the future?
We've spent, for the first month, we spent $8.7 million, and then we're budgeting up to $5 million for the final 2 weeks. But we won't, it's an application process, so that's an estimate based upon usage.
Governor, you mentioned you've learned a lot about, especially infection control in nursing homes, and I think it was yesterday or the day before when you talked about nursing homes and letting patients leave the hospital with COVID to go to nursing homes, and maybe that wasn't the best idea, but at the same time you cut off visitation. So how do those two things kind of square with each other? If you knew it was a problem to let people into nursing homes, but also let people in from the hospitals, and what was the thinking?
Well, now we've stopped both. So what I said was that in the very early days, we did, folks were released who were COVID positive to various nursing homes. And now we're not doing that. Now we're putting people together. We have these COVID positive homes.
I guess what I'm getting at is, was that still after the visitation was stopped? Were people being allowed to leave hospitals while they were COVID positive after visitation was stopped?
Not.
Okay.
No, I think not. You're like testing my memory, but these releases were like in the first few days or week that we were getting ourselves organized. And then very quickly we shut down that practice and shut down visitation. And still, as you know, shutting down visitation and shutting down that practice. Also, at that time, we weren't even testing people. So, we've learned a lot, but so now we are just through our third pass of testing, offering testing to every employee of every nursing home. And we have these point of care tests. We're doing the mobile testing in nursing homes. So we're just a lot better at it than we were.
On nursing homes, I think yesterday your answer to Brian's question about, Massachusetts is allowing some people to visit their loved ones in nursing homes again. You doubled down on your decision not to do that. I think some folks are frustrated.
Yeah.
Can you just shine some light on the metrics that you guys are looking at to determine when you will allow that to happen again? I know you mentioned yesterday potentially during phase 3.
Yeah, I'm going to let the doctor answer this. I should say that our decision on that has been completely led. I have deferred completely to the Department of Health, so I'm going to let him answer that.
Obviously, it bothers us a lot that people can't go visit folks in the nursing home. I just want to get that out. It bothers me. We feel very bad about this. What we're looking for is this, and if this guidance should be released today, is every nursing home to actually develop a plan in assisted living for how they're going to accept visitors. I just want to emphasize the risk. And part of why we just need to get this out in the open is 80% of our deaths are folks older than 60 years old. Very vulnerable population for folks living in nursing homes. Part of that too is just that, a lot of our folks who are older can do fine with home health care workers. We have a great home health care system in Rhode Island, which we're very thankful for that. They do really good work. So when we get though to this, it's a very vulnerable population. So what nursing homes need to do is look at what they have as their nursing home and figure out for them how they can interpret our guidance connected to the CMS guidance. CMS is Center for Medicaid, Medicare Services, connected to that guidance as to what makes sense for that nursing home. Some nursing homes are going to be in different places than others are. Others will be like, you know what, we can figure out a way to do this in phase 3. We'll be okay. Some are going to be like, we're not so sure we're ready. And part of what I'm getting into is, it's not like one nursing home is just like the other ones. They're different. And you have to look at the nooks and crannies of a nursing home to really see how does that nursing home interpret this. And it really gets to underscoring the concept, this virus is exquisitely transmissible. And I think it's just one of those things to really take home and just own as a concept is, the virus spreads so easily between person to person here. And if we could just hold on for a couple more weeks, my friends, I think we'll be in a much better place here. And I think that's just patience. It's hard. It's hard for me to be patient. But patience is action. And we're looking for the long haul here. This is a marathon. We are day 96 since patient number 1 in Rhode Island, day 158 as a planet. There is much we have learned. In a few more weeks, I think we're going to be in a much safer place. And I would just ask us to hold on a little bit longer. And I know what I'm asking for people to do is hard. It's hard for me. I'm as frustrated as you are because it's really hard not to connect with our elders. It's so hard to connect with our spouses. I've heard so many stories from people saying, I really want to get back in there, and I get it. I really do.
Doctor, as long as you're at the podium, the National Counterintelligence and Security Center, part of the Office of the Director of National Intelligence, issued an advisory expressing some concerns that a number of the commercial laboratories that are handling testing are co-owned or otherwise responsible for things like maintaining a genetic database in China. And they've warned that this may concern people. Do you have any knowledge of any connections, or are these being used in Rhode Island? Are those the commercial labs that are doing work in Rhode Island? And what safeguards are there to prevent compromise of personal health information, including genetic material?
So the first I'm hearing about your question is right now, and first I'm hearing about that as an issue is right now. So what I will just say is, I will look into it. The other thing I will just say is, I expect every healthcare provider, every healthcare laboratory to follow federal and state law when it comes to protected health information. The other concept though is, and I think you brought up a really interesting concept about genetic material. That's important, and that's private too. So we just can't willy-nilly throw things around here. But your genetic material is yours as well. That can't be released without your consent. So thanks for raising the issue. I'll look into it.
Dr. McDonald, while you're up there, could you just clarify exactly the distancings and the mask? I just came from a press conference at the State House, and we had state elected leaders shoulder to shoulder. And I said, you're supposed to be spaced out, standing there for over an hour, over in 15 minutes. And one of them, I don't know who, said, oh no, we're outside, we have masks on. But could you clarify for people? I was still under the impression, I think a lot of people, it's not like passing in a store. You should still be distanced when you're standing for a period of time.
Yeah, so exactly right. I don't care if you're outside or inside. You need to be 6 feet apart. Dr. Chan was just talking on a CME we were doing yesterday for the healthcare providers in the state about a recent study that showed if you're within 1 meter of somebody, much higher risk than if you're 2 meters out. So it's really important not to be near each other. And by the way, I get how unnatural that is, by the way. Like, we've grown up as a culture walking side by side each other. When we go to meetings, we think it's polite now to be next to each other. I know that's what we're used to, but what we're used to could be life-threatening to us. And so it's really important. We've done this before. Double arms length away. I'm 5'4". I'm not quite, but that's, you know what I'm saying, my folks? What I'm saying is you gotta be at least 6 feet away from each other. And one of the things I think is important too is like, I love the way you're asking it. You're so gentle and respectful, but sometimes I think we just be really gentle and respectful to our peers who aren't doing these things. I'm in Home Depot shopping for, the little guy wants to put a garden in, right? So putting in the garden, right? And I'm trying to get a little watermelon plant. Someone comes right next to me. I just pulled back. If you need that watermelon plant more than I do, God bless you, go enjoy it, right? But I'm pulling back, same with my little guy. We're just staying 6 feet away. I'm role modeling in a polite way. I'm not judging others. I'm not yelling at people, nor am I encouraging anyone to. And I think it's just important to be really kind to each other. We're all learning these new skills. And when you see people, do this. I was invited to a public gathering. There was media there. People weren't 6 feet apart. Someone's talking. I just stopped the person and said, we're going to be 6 feet apart. this is what we're going to do. And everybody was like, oh, good, the doctor said that. And it made people feel better, right? And I guess what I'm saying to you is if you could just remind people, the reason why I want you 6 feet apart from each other is it's just safer for you. And I think it's just important. Like I was hiking over the weekend down at Chafee Park in North Kingstown, had a great time. I didn't see everybody being 6 feet apart. I'm not the 6 feet police though, right? I didn't say anything to folks. What I did was I role modeled with my family. We were 6 feet apart from each other. And we're wearing our masks too, by the way, because I just think it's important, all right? So thanks for asking. And by the way, whatever you do in this world, the reason I want you 6 feet apart is when you're closer than 6 feet away, when you exhale, you might be asymptomatically throwing out this virus, which I've told you it's a thief. I don't like the virus. I respect it, but I don't like it. You could be infecting someone else, and we have to be other-oriented. It's part of just recognizing the value of each other. Thank you.
Follow up on your family. You shared with us a week or two a very nice story about your daughter and how she's. I'm just curious, how does your family react when you share a story like that? Any feedback on that?
How did Sarah like her story? You kidding me? She loved it. Sarah, if she could be an actress, she would be. Like she was going to be in Dolly, right? So she loved the story and she's thrilled I did it. And what blew her away even more was Ed Fitzpatrick from the Boston Globe put it in it's the Boston Globe, right? And she's reading about herself. And I said, I remember saw in the article Friday morning, I said, sweetie, you made the big time. Congratulations, but you ask how my family interacts with this, and it's like, I think they recognize daddy's not home as much as he used to be, and when he's home, he's not home. And one of the things that I'm learning about this is how to be with my kids more when I'm home. One of the things I'm noticing too, though, is I'm missing certain things in life. And one of the things part of why I keep saying the virus is a thief is it's stealing a little bit more of my joy than it used to. My kids have these great events in life and I can't share with them. And so like this Friday night, we're going to go see Sarah graduate from high school. And I'm excited about that. We're going to do it from a car, and that's fine. And that's the way it should be done. School's doing a very responsible job at that. But I think it underscores how our lives are different. They're just not going to be different forever. It's going to get better someday. We're going to be in a happier place, and it's going to be okay.
Kind of playing off Dr. McDonald and the school theme, I know it's still a few months away. As things stand right now, what is your thinking on schools? Would it be possible even to send kids back to school in some fashion, or do you think that's out of the question if there's no vaccine?
Good question. Yes, it would be possible. And next week, I'm going to lay out some plans around school. That is, we got a bunch of news next week. We're going to put it into Monday, Wednesday, and Friday, and school is on the docket. I want to open school. Kids deserve school. So we're working really hard. And if you just give me another week, I'll come back to you with the details. But the short answer to your question is yes. Is it possible? I think it is.
I know this has been floated out there too, kind of like a hype, the some at home. Is that really a possibility, and how does that work with people's childcare? It's like, how do you tell people?
Exactly. So this is why I need a little more time. And actually, we're going to be working throughout the summer to figure it out. I think there are certain things we do know. Like when I was saying earlier about telehealth, telemedicine, that's working well. We've learned that innovation. We should make it permanent. We should pass a law and make it permanent. Well, the same is true with distance learning. I'm not suggesting we want to be permanently and forever exclusively distance learning, but we know that kids can't be going to school when they're sick. So but the good news is we're gonna be very strict about not letting kids come to school when they're sick so they can work at home and do distance learning. Maybe it's the end of the snow day, right? Like forever, kids have, that's the news, right? Like kids forever have missed school for school days. Well, they've been distance learning for 2 months. Why don't we just pop to distance learning? So it is my strong desire to get these kids back to school. Obviously, we have to do it safely and responsibly and with great detail. And I'm going to dedicate one of these next week to do that. Right now, we're still talking to teachers, superintendents, parents, principals, et cetera. But yes, I do think it is possible.
Governor, I think that maybe this will be the end of the snow day. It's going to be the headline in every article.
I know, yeah.
Is there any formal assessment that you're making on how well distance learning is going? I know you're getting informal reports.
Yes, actually, the Department of Education is making pretty detailed formal assessments right now, as the school, still a couple weeks left of school. Just around, yes, the short answer is yes, attendance, grades, curriculum, they're really digging into it. I would say that in general, we've been pleasantly surprised. I don't think we knew what to expect when we went into this. I think it's fair to say it's gotten harder the longer it's gone on, but by every account, it's been certainly exceeded my expectations.
Do you think we are done with the National Guard and with the curfews and so forth?
I do not. I do not.
Where do we stand with this?
You mean with the civil unrest? Yeah. I have to get my crises correct. So the president has just said yesterday that we can use and be federally reimbursed for the National Guard until August 21st. That is very welcome news. Right now, we have over 1,000 Guard deployed in these dual missions. We definitely still need the Guard for contact tracing, testing, quarantining, et cetera. The Guard is still heavily deployed as we meet the potential security threats. They are today, they will be tomorrow, they will be through the weekend. And I don't know. The answer, Steve, is I'll need to keep them there until I feel it's safe, and I don't know when that's going to be.
Will you have troops at what is expected to be or planned to be a peaceful rally tomorrow?
We're trying to, yes, there will certainly be security, and I'm happy to talk to you more about that. That's how I'm spending the afternoon, getting fully briefed, but we're working around the clock with local law enforcement, the Guard, and the state police. There are, last night, by the way, there was a very peaceful and wonderful protest in Woonsocket. Great. There are, I think, 3 or 4 peaceful protests planned tomorrow and Saturday in Providence and in Bristol. We're going to do everything we can to be absolutely supportive of that. Department of Health will be there passing out masks. In the evenings, we're going to be very vigilant. We are going to do everything we need to do, 24-hour surveillance, to be very vigilant.
I was just going to ask about some of the frustration that we're hearing from our viewers, our readers, our listeners who are watching these protests happening, large gatherings, who are saying to us, well, then why can't I have a traditional graduation or a backyard barbecue or a wedding? What is your message to those people?
Yeah. I get it. I hear that. I do hear it. As I've said all along, my job is to tell you what you should do to stay safe. Right now, the social gathering limit is 15. So Brian asked me the other day, were you at the protest? I was not. I support it 100%. Social gathering limit is 15. Mask wearing outside. So what I can tell you is like what the doctor just said. If you want to have a graduation, the safe, responsible way to do it right now is in your car. As I said yesterday, if you're going to participate in one of these protests and you have a vulnerable loved one at home, man, you better think twice before you do that. And look, I think this is an unprecedented moment in America, what we are seeing. People are going to protest. I support their rights, and I'm just asking them to be socially distanced, wear their masks, and do the best. My whole approach from day one in this is to encourage voluntary compliance. So there's been protests throughout this. We have not been heavy-handed in our enforcement. We're not going to start that now. I'm encouraging voluntary compliance.
I understand from some eagle-eyed viewers that the mask executive order was set to expire today, I believe.
I renewed it. I signed it last night to renew it for another month.
Thank you.
For another month. Thank you. God, I'm glad someone's reading all the fine print of these executive orders. All right. Thank you.